Gentlemen and ladies, good day. We continue with the prevention of coronary heart disease, and now we are looking at the subtypes and symptoms. Understanding the different subtypes is very, very important for us to actually target the interventions that we need to to um, to create for to administer for these our clients or our patients. So if we do not understand the types, we may not know how to develop objectives for us to be able to help the patients. So the differences, it is also important to know about the difference between stroke and coronary heart disease. Both they are a result of problems with the vascular system, and therefore we are talking about blood vessel stroke is a problem with blood vessels in the brain, and coronary heart disease is a condition resulting from blood vessels that supply the heart. So we have to understand, and so even the interventions that should be related to how do we prevent stroke and how do we prevent coronary heart disease will be actually slightly different. So understanding these differences can help to implement more effective preventive measures so that we actually target issues relating to lifestyle changes and also medication interventions. The pathophysiology is important to understand because if we understand how these problems develop, then we will actually be able to devise the interventions that we need to be able to do that. For coronary heart disease, the blood vessels that supply the heart may be affected in terms of the too much cholesterol that begins to accumulate in blood vessels, creating what are called plaques. Now, these plaques end up narrowing these blood vessels, leading to significant uh, reduction in how much blood reaches the distal tissues of the heart. So reducing blood flow ends up increasing the risk of heart attacks. So what would be the importance in terms of interventions that recognizing this pathophysiology of coronary heart disease then gives us an opportunity to be able to develop measures that will reduce high cholesterol levels, measures that will actually reduce our exposure or the patient's exposure to foods that contain too much cholesterol, and how exercises and the rest of the interventions can actually improve that. Other than that, we also need to see that because we understand it's cholesterol, which is the major problem here, then we can also provide medication that can reduce the conversion of our food into cholesterol in our bodies or in the patient's bodies. What would be the common and asymptomatic preventions of coronary heart disease? Is that the symptoms is that in patients who have congenital disease, who are born with a problem in the coronary blood vessels, the symptoms will range in them showing signs of fatigue. If it's the children, you even be able to see that they are not playing with their friends, or they will play and they will, but they will not catch up with the activities of their colleagues. They will be resting more than the colleagues and things like that. They will present with shortness of breath, sometimes even cyanosis. Asymptomatic cases, many individuals who are not showing symptoms of coronary heart disease may actually just come and experience an event where they have, for example, shortness of breath, or they have angina episodes, or even just a heart attack. So it is important that patients who are at risk of coronary heart disease are actually encouraged to continue to have screening for problems that may lead to coronary heart disease so that the preventive measures are administered for them. Risk factors and objectives for interventions. When we focus on the risk factors, then we can actually develop interventions. So the risk factors for coronary heart disease include hypertension, high cholesterol levels, smoking, those who are diabetic. You know, diabetes affects not only the autonomic nervous system, presenting with the risk of hypertension, but also diabetes affects blood vessels, and also the lifestyle, sedentary lifestyle leading to obesity actually also predisposes to coronary heart disease. So where they end up with unnecessary low dense lipoproteins, and recognizing these factors may actually help us to craft preventive measures that will need to be done for this. And so obviously the preventive measures that we have to manage hypertension, we have to reduce cholesterol levels for these patients, we have to encourage them to stop smoking, we have to encourage them to reduce alcohol intake, we have to encourage them to adhere to medication for diabetes. Those who do not know, they have to screen for hypertension, screen for all these diabetes, and also reduce their body mass index or maintain their body mass index in the normal range. Um, what would be the targeting interventions for high-risk individuals utilizing patient data? So if you have access to patient data, which you can get with the patient history, you clock the patient, you talk to the patient, or if you are in an environment like a clinical environment, the hospital, the files that come actually may indicate to you data that you can use to develop interventions and counsel the patients. Otherwise, we are talking about what would be the goals for primary and secondary prevention is to reduce risk factors, improving patient education, and also enhancing access to treatments, and also ensuring that we play our role in achieving prevention of cardiovascular disease through patient management of their medication and patient support. In conclusion, we are saying that understanding coronary heart disease is crucial so that we can actually play a role as pharmaceutical personnel in preventing heart disease. Otherwise, study well and go through these, as well as study extra material on this so that you can understand this and also understand what we are going to look at next. So we'll be looking at what are the possible things that we need to understand for us to be able to help the patient.